clinician that attended Part D, a 31-year-old female physiotherapist who in her own capacity also works in an outpatient department, does some inpatient work. And she had a shoulder injury about 6 weeks prior to this, where she lifted a heavy patient, she said, and started experiencing a lot of anterior shoulder pain in her right shoulder. So, yeah, needless to say, always looking for extremity patients. So great if one of the clinicians present. That's also how we came about the video. It's not every day that you have videos handy when you're seeing patients. I mean, we see these type of patients daily, but you're not recording every single patient. So that's what made this quite unique, is actually having video. This being a clinician, she very comfortable with us sharing her video. And I use this case on a lot of the overview lectures that I also present on the McKenzie method, specifically because the extremities, there seems to be a bit of difficulty in taking up the burden of using MDT in extremities. And once you do that, it really simplifies extremities dramatically. So I know from my own personal experience that it's difficult to make the mind shift, but now that I've made it, I can't understand why it was so difficult to take on that burden.
Right.
All right. So just to let you know about her functional activities, her main complaint was that she's unable to blow dry her hair. Just holding her hand up above her head, blow drying her hair in the morning is difficult, about 10 minutes or so, and she just can't sustain that action. She's quite an active person as well, and she does a strengthening program a few times a week in the form of a boot camp, and showed us also another functional activity where she does a hand to elbow push-up, so onto both hands and drop down onto elbows one at a time, and comes back up, and then really struggling on this right side to come back onto the hand. That unilateral push-up just doesn't have the strength in that.
Right.
And this pain of her varies between about a 2 and a 7 out of 10 pain, but she says it's a constant discomfort. Constant discomfort in the shoulder. Upon asking her, the location of the symptoms, anterior, yes, that's where she feels it primarily, and the constant discomfort was anteriorly, but then at times there's some pain that radiates down into her upper arm, and some pain that comes a little bit higher up above the shoulder line. So, the spread over the scapula is then included in that intermittently there.
Mm-hmm.
All right. The patient also comments that she has a history of cervical stiffness, not necessarily pain. But like most of us, when she sits for long periods of time, she feels some stiffness in the neck. So that brings on that question whether this is a cervical patient or not. On the form, I actually said it's unchanging. So she, she's not improving rapidly. Maybe over time, she says she's gained a little bit of strength, but it's certainly not improving. And she wouldn't refer to us because she's one of the participants. Her plan is that she had a shoulder surgery coming up within the next month. She's had 2 scans by this time, and this is one of the first things. And I know a lot of our patients, even though we don't ask, that's a concern for them. So she brings up the imaging quite quickly. She had a sonar done that showed a supraspinatus tendinopathy. And when she didn't respond to treatment to this tendinopathy, and treatment-wise it was strengthening, trying to load that tendon, she's actually done one of Jill Cook's courses before she came onto Part D with us. So she's followed that regime, and it just wasn't working for her. That led to her seeing one of her colleagues, a specialist that refers to her, that sent her for an MRI, and that showed a grade 2 slap lesion on that right side. And the plan was that the next step would be surgery. So obviously, being a physiotherapist, he says, I want to try and avoid the surgery as far as we can.
Month after month, new guest experts sharing actual patient cases, and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.